Nice to see you, Greg.
Yeah, nice to see you again.
So we did the stem cell therapy 6 months ago. We normally change our treatment this year because we're doing twice. Previously we used to do once in order to get the maximum benefit. So we do one and then second one 6 months later, which is about you'll have the second one. But following the first stem cell therapy, which was 6 months ago, I just want to see how much has changed in terms of symptoms, control, and quality of life changes.
So I think comparing to 6 months ago, my quality of life is better because I'm able to walk a lot further. When before I had the treatment, and generally after 500 meters I'd be quite sore, and after 4 months when I travelled around Europe I was able to walk up to 20,000 steps a day. I wouldn't have been able to do that prior to that treatment. So that was good quality of life.
That's very good.
From that perspective. But from a day-to-day perspective, it also means I can actually walk into the office, or go upstairs. It actually got to the point where I didn't go into the office for about 6 months because
prior to the treatment.
Yeah, that's right.
That left hip was problematic for how many years?
It developed about 1 year prior to our treatment.
Okay. And how did you find out you had the hip problem?
Initially, it seemed to be my hip was going well. I was competing in weightlifting up until March last year internationally, and then in May I had trouble walking back from my letterbox.
Yes.
And I was just, it felt like I was almost, I thought I had some sort of injury, but it wasn't diagnosed from a perspective of I didn't have an X-ray for 4 months, and then when we had the X-ray we could see that there was wear on the left-hand side.
Yes. You must have had used your bodies, your joints and muscles extensively during your training and championships. Can you just tell me a bit about what sports you've been doing and what you have achieved prior to the therapy?
Sure. So I've been doing weightlifting for I've been competing in weightlifting since 1991. So I've been competing for 33 years in both powerlifting and weightlifting. I've represented New Zealand in both sports, and in the last 7 years I've won a few masters competitions, like the World Cup. I won a World Championship and placed in World Masters Games as well.
What made you to decide to go for stem cell therapy?
For me, I would want a natural approach. When I first looked at this, I looked at some of the case studies that you had, studies around the world, and I could see that there was about an 80% chance of having at least a 50% improvement.
That's good.
And that is something that I wanted to try before going down into a hip replacement. The other thing is my second sport is doing skiing. Yeah, so snow skiing is an interesting one because Arnold Schwarzenegger had a hip replacement in the mid-50s, double hip replacement, and he had an accident skiing, and he believes that the replacement hip was the reason that he had a breakage of like 2 or 3 breakages on his leg, and he thinks it's because the artificial hip was so much more stronger and more solid than the bones.
I wish you all the best.
Okay,
Thank you.
Thank you.